Congressman Armey, I'd like to stick with you because you seem to be arguing that the main problem is that Medicare or some other government-financed program conflicts with your inherent right to go without that if you want to, in fact, go without that. You could be free to go without that. But Medicare is not a mandatory program. In fact, you can only get into Medicare if you've worked for 10 years in covered employment. And the part of Medicare that pertains to doctors and outpatient services and drugs is entirely voluntary, and you can freely not enroll in that. So why are you so upset about a program which is not, in fact, mandatory, as you said?
It is mandatory. And I'll tell you the way it's mandatory. I'm a healthy guy. I intend to stay healthy. I don't drink, I don't smoke, and I don't cheat on my wife. I may live a long time. But should the day come that I am required to be hospitalized at the age of 67, there's not a hospital that can take me without being severely punished by the federal government unless I present a Medicare card. The sanctions against that hospital make it prohibitive for them to honor my personal liberty to come and pay cash.
So you're worried about the rights of providers here. This doesn't have an effect on you.
Bless your little old heart, you just don't get Howard Rourke. It's about my personal liberty. I'm talking about I love a nation that gives me the right to be me, as God made me to be free, to choose for myself, that compels me to become a ward of the state. They started with everybody over 65. Now they're going with the children. How long do you think it will be before it is all of us? Are you free? My mother paid, I remember when I broke my arm as a child, she paid the bill to the doctor with the delivery of coal. You think this government could find it in its heart to tolerate that? Well, they would be appalled by that. But I'm just saying, we want to take care of the poor. We want to take care of people. Now, when we proceed with this debate, I might as well just be a little preemptive here. We're eventually going to get to this point. It's not right for a poor person to have less health care than a rich person. It's not right for a poor person to walk while I drive a Lincoln. That's the difference between being rich and poor. Take care of the poor to the extent that society will afford it. But leave us alone if we can do it for ourselves.